we get patients from all over Virginia. We get patients from, all up and down the East Coast. And we get to work with patients of different, socioeconomic statuses. Being able to see all of this variation kind of opens your eyes to the, unique challenges that everybody has, and how we have to kind of consider that in every move we make when we're treating these patients. There are 4 different teams, and they are specified as the schizophrenia team, the mood team, the geriatric psychiatry team, and the medical psychiatry team. We all hang out in the same team room, just talking about different patients and bouncing ideas off of each other. It's pretty enriching to have multiple people around, all with very different backgrounds and very different experiences and understanding and opinions, all being able to collaborate.
Staff here has been amazing. I mean, being a new intern coming into residency, it's kind of scary, knowing that, now you're a doctor and you have some level of autonomy. VCU has a balance for that, to give you the autonomy that you need to be able to make decisions, but then you also have the support of your staff. You're going on a unit, and sometimes patients can be aggravated or agitated. So it's nice to be surrounded by staff that can be supportive because they're familiar with these behaviors. They know how to handle these situations. We're here to help our patients. We want to make sure that we're being safe too. When you go to the more acute floor, you have behavioral specialists that are available to come in the room with you in the event that a patient is more violent. We have systems in place that you have like a notification when you enter a patient's chart of violence precautions. You're never going to be blindsided going into a room because this is going to flag, hey, just be cautious.
ECT is electroconvulsive therapy. It's one of the only procedures done by psychiatrists, the other one being transmagnetic stimulation, TMS. We have the unique opportunity here at this facility and at this program to have our own ECT suite here to, see our patients get better in a controlled environment within the inpatient setting, or through the outpatient and ensure that they have proper follow-up. And see them get better and progress. You get a more hands-on approach where you work within the ECT, determining how much power or energy a patient gets for a specific treatment, monitoring any side effects, adding any medications prior to treatment or after treatment to control for side effects. And it's nice to be around people who actually care about their craft and want to put in work to cultivating it. We have attendings that are doing research on the side and are always up to date on how the field of psychiatry is constantly changing, and they always take time to incorporate that and how they teach and treat patients. And as a resident, you're seeing that hands-on. That's a very relaxed environment here. And as a program in general, we always look out for resident wellness and making sure residents are well taken care of. And ECT is a testament to that. Treatment itself is fairly short. You go through your sets of treatment, and by the afternoon, you're done. And you have time to study, you have time to get to hang out with your other residents, or, take time for yourself. As a resident, I feel extremely well supported here.
When they built this building, they wanted to bring in a lot of light and hope, just bring some uplifting positivity to your workday. It gets you into the right headspace. Patients love it. The inpatient units themselves actually have windows and there's a lot of light that comes in. The patients, have their individual rooms, very comfortable space. Everybody rotates through child at VTCC, which is doing inpatient work. You get to work within the context of an interdisciplinary team of people who are all helping to help these children. There's a big focus on trauma-informed care here, the contribution that trauma might have to their clinical picture. I think that the program gives a comprehensive exposure to child psychiatry, including outpatient exposures, inpatient areas, and consults, so it's a little bit of a sampling from each area. Work-life balance on VTCC rotation is amazing. You don't have to take a call during your rotation here, and you also get weekends off, which is very unique and wonderful.
It's a beautiful building, the architecture, the windows, it's all gorgeous. So it's so nice to do your work in a, aesthetically pleasing space. And there's side rooms, multiple side rooms with beautiful views that we bring the patients to have private interviews one-on-one with the patients. So there's a variety of different types of rooms to fit different needs. One of the great things about being, in an urban area is, the patient base to support multiple subspecialty clinics. So, we have HIV psychiatry clinic, we have high-risk OB psychiatry clinic, and Motivate clinic for substance abuse, among many others. We expose people to psychotherapy early on in the beginning of second year. The way our program is, it's front loaded. So there's less and less call every year, to the point of third year, you only have 15 calls spaced out there over the whole year. And then fourth year, no call at all. So plenty of free time as you move along.
You get to know people that you work with really well. Building the bonds with your fellow residents is going to be really important, because you're going to be the ones covering each other's shifts. And your third and fourth year, you've built that bond with other people, and you have more time to kind of explore the city. Richmond has everything that a big city has, but it's just more compact. We're getting a lot of breweries, there's music venues, there's local sports teams. Between clinics, we'll usually have a lunch break, which is a nice added bonus of third year residency. If you want it, it's here in the neighborhood, and you can just run out and quickly grab something between clinics, which is lovely. Right here in Jackson Ward and downtown, you're close to really great options of where you want to live. No matter where you choose to live, kind of what your preferences are in a neighborhood, you can get to the Jackson Center, you can get to the main hospital in a 10-minute car ride, a 15-minute bike ride. It's all very, very manageable, kind of transit-wise. It's a very welcoming place to be.